This conference will now be recorded.
Okay, so thanks to Michael, we have an agenda and some background information. Before we get into that, I wanted to go ahead and read back through the language that was used when this work group was created, just so we have a kind of the foundation for why we're here today. And this was in the chairman's report from the February 6, 2020 policy board meeting. So the Vision Zero work group would establish regional goals as well as gather support and coordination at the regional level. The work group would also support local transportation safety organizations to improve safety around the region. The City of Richmond volunteered to chair the work group. Thanks, Michael. The RRTPO policy board needs to request tax assistance in order to establish the subcommittee, which was done. Chair requested action to authorize TAC to review and provide a recommendation for membership and integrating this program into the Unified Planning Work Program. So thanks to all of you and TAC. The membership of the work group is established, and that's everyone here today. So before we, I think, turn things over to Michael, does anybody have any questions or comments? Okay, Mike, what would you prefer? Do you want me to show slides, or do you want me to turn the presenter over to you? What's the easiest thing to do?
You can just show the slides if you'd like, and we'll forward through them at whatever. If I talk too long, you just go ahead and forward to the next slide, and we'll move along that way, right?
Sounds good.
Okay.
Okay, can everybody see that?
Yes, I can see it.
Okay.
You want to go ahead and forward to the next slide? I just want to say welcome to everybody. This is really exciting from my perspective, being a Vision Zero coordinator in the city of Richmond. And I just wanted to put together a proposed agenda, which is in front of you, trying to do as much of the legwork ahead of time. I know in these interesting times that the more legwork we can do before a meeting, the better the meeting tends to go. So what we'll do is we'll walk through these and feel free to ask questions along the way. It's intended to be interactive, and for the most part, if we just want to present these things today and decide on them at a later date, that's fine too. Or we can, as we go, adopt them as we go. So totally flexible. I want to serve as a technical resource. I've done this pretty much all my life. This is what I was made to do. So I appreciate your time today. With that, if you're good, we'll go into the leadership.
Hello, everybody. This is Ryan with VDOT. Sorry, I'm a few minutes late.
Hey, Ryan. Welcome.
How are you guys doing?
Mr. Reed as well.
Yeah, Mr. Reed is on vacation. That's why he threw me in.
Okay, great. But if you like, we can move on to the next slide and go from there.
Sure.
So I think there's probably a few more organizations here than listed. I'm not sure, but everyone is welcome. I think it's important to select a chair and vice chair. So I don't know if there is any nominations, or we just want to think about this now and get back to welcome feedback.
Yes, and I think just for some background, the organizations that are listed here are all members of the TAC, and those were the ones that were initially volunteered to serve as members. I think this is an advisory committee, so I think we want to operate the group on a consensus basis. We don't need to be formal with motions and seconds, but I think we certainly do want to have at least the chair and vice chair to make sure that things go smoothly and to speak for the group. So does anyone have strong feelings? Anyone feel like they want want to step up and serve in a leadership position?
This is Sharon with Henrico. I'm willing to vice chair. Don't think I quite want to chair yet, but I'd be willing to vice chair or help out.
Great, thanks, Sharon.
And this is Mike Sawyer. I'm perfectly willing to serve in whatever role you need me to. I don't know what the technical rules are as far as being a member of the TAC or not. So that's the place where I'll leave it to you guys.
Well, Darona's a member of the TAC.
Hey, Chad. It's Tyrona. Hi, everybody.
Hi.
I can be the chair if we need it, if regard for the city of Richmond.
That'd be great. And I think in terms of meeting organization and being resources, if Mike, if you can kind of tag team it with Darona, I think that'd be great.
Yeah, he can be mine.
Happy to serve. Glad to do it.
Thanks. And staff from the TPO will be happy to administer and take notes and do everything to make sure it runs smoothly. So great.
Go to the next slide. So we really want to define the issue, right? The goal of a Vision Zero initiative is not to eliminate all traffic crashes. It's to eliminate the traffic crashes that cause death or injury. And in order for a crash to cause death or injury, it needs to have crash energy that the human body can't withstand. And we all know that speed is a key component, a key vector. If we are looking at this from a health perspective, and it's that speed creates an exponentially greater crash energy. And so a safe systems approach tries to protect us from that crash energy. There's a diagram that's pretty popular, that circle next to the words there. And it really talks about safe roads, safe vehicles, safe people, and safe speeds. And what I tend to focus on is the speed part of it, and trying to get the built environment correct, which is the safe roads. There's not so much we can do with safe vehicles in our professions, but we kind of deal with those. And then we have to deal with the behaviors of the individual people making decisions every day. So any questions on that slide? If not, we'll move on to the next one. Okay, so here's where we're going to talk a little bit more. And I sent something this morning that was from VDOT's PSAP, their Pedestrian Safety Action Plan. And I've really dug into the details with this. This past week, California recently, through their Vision Zero task force, had a big thing about speed limits, and safety. And so that's really informing what I'm about to say to you today. So a popular graphic is the one on the top left. And where it gets confusing for people is that graphic in particular looks like, hey, if the speed limit is this, then this occurs. And what it's actually trying to say is that's impact speed. But even that data that was used is kind of self-reported. So you're telling the police officer says, hey, how fast were you going? I was going the speed limit. Okay, I'll write it down, 35 miles an hour. It's only what is self-reported. So that's not a very good way to look at it. If you look at what I sent this morning in the email, it'll show a graph or a number of posted speed limit signs, and it talks about at a speed limit of 25 miles an hour or less, it is a 94% survival rate for pedestrians. If it's 30 to 35, it's 79% survival. If it's 40 miles an hour or greater, it's 65%. So that's based upon Virginia data. So I would just point out that both of these charts, both the top and I'm about to talk about the bottom one, really, and Chet's bringing it up now, the VDOT graph. So that's what was published in a report based upon the crash data. And just wanted to point that out, that's more accurate because the police officer is not going to make up really the speed limit. That's something that they can find as a fact. Until we get everyone using the black boxes that are kind of in vehicles to determine what the impact speed is, it's very difficult. But we can use some of the research and the science that behind it, and that gets to the graph just below the chart we were just talking about, and it has 3 different S curves, one for pedestrians and cyclists, kind of the vulnerable users. I would also put into there the people that don't use seatbelts because they're also unprotected. And those are the speeds that we can just withstand. And you can see where that curve goes up. So what we try to do in the bullet points 1 through 4 is, what is the speed that is the impact speed where that really starts to incline and exponentially cause greater harm. So for people who walk, bike, and ride, 25 miles per hour is where that point is. For a fixed object, it's 30 miles an hour. For an intersection crash, it's 35 miles an hour. And for head-on, that's 45 miles an hour. And it's important to note here that we're trying to protect people from speed, and you can see most airbags and seatbelts are tested below 35 miles an hour. Okay, that's where you talk about the Insurance Institute for Highway Safety, where you see the crash sled, and they take the measurement with the crash test dummies. Those are only done at 35 or so miles an hour. Any questions on this slide? Okay, if not, we'll move to the next. Okay, so I just wanted to give you a few tools that are out there, and there should be in your PDF that you received links to these. I don't know how many people are familiar with all of these tools, but I'm going to explain kind of how I use them very briefly. So the first one is VDOT's crash tool, and that's the one that I find to be most useful. They just updated the data today to be through March 2020. You're going to see a couple of the charts that I use come from the Power BI tool, and we'll go through that more directly. The VDOT dashboard is very useful for a jurisdiction level look, and it can give you a very accurate, up-to-the-minute type of information on fatalities, and it also has a little bit of a lag on the dashboard. The third tool there is the TREDS report from DMV. And this is what I use to see up to the minute as things are being entered. So right now I can see things being entered for April, May, and June. They aren't finalized yet, but it just starts to give me an idea in real time what crashes are occurring. So I use that for identifying things in the most recent months. They added in January something very useful to me, because when we focus on the crash problem, again, we're talking about killed or serious injury. So we talk a lot of times about a CABCO scale. I don't know if that's a familiar term or not, but K is for killed, A is injury type A, which is incapacitated. Those are the first two, the most severe that I'm interested in, is the K plus A. And then you have B, which is visible injury, C, which is non-visible injury, and O, which is property damage only. Okay, so I'm looking at it from a KA perspective, and they gave me a good filter here recently that allows me to look at KA crashes only. So I can start to get real time what those numbers are. And then lastly is kind of the 911 dispatch, and at least 3 of the counties, two counties in the city have kind of the dispatch listed there on the city website, where we can see real time. If you click on that, you can see what crashes are happening this minute and who's dispatched where and what level of crash it is. Any questions on those tools? Anyone use those tools?
I mean, this is Sharon with Henrico. I mean, in the past, when I was in traffic engineering, we used treads a lot.
Very good, very good. These are just very useful things to keep an eye on, and that's what I use pretty much every day. I'm checking or using something to communicate something about safety in the city using those. So if no more questions, we'll go to the next slide. Okay, so this is defining for the last 3 years that are available, 17, 18, and 19. And that should be K plus A people, okay? And that is just our most severe crashes. And in the smaller table there, you can see sorted by, I think it's injured people possibly, high to low, what our current situation is. And you can see the big three, of course, are going to be Chesterfield, Henrico, and Richmond. And I often say this, that our rural friends come into these more populated areas and have crashes. So it's an everybody hands on deck type of issue, even though this is the jurisdiction that receives the most as far as our KA crashes. They are also where we want to focus. So from a health perspective, I never really look at the crash side. I look at the people. It's the number of people per 100,000. It's not a vehicle miles traveled type of transportation question. This is a health issue. So we look at people and injury rates per 100,000 people. But the sheer number over the 3-year period, you can tell that we have some work to do, right? So any questions on this slide? And Ashland is doing a lot better, right? Way to go, Ashland. We all want to be where Ashland is, right? So if not, we'll go to the next slide. And this is a result, both of these two slides here are a result of the Power BI tool. I just want to walk through this. I'm going to start in the upper right corner and just talk about the 3 years of data. And you can see that we have interstate crashes, right? So this is not just a local issue. This is our state partners working through the Virginia State Police, as well as our VDOT partners as well. And that I speak to that from a state perspective because we're owning and operating all of our local streets. Of course, in Henrico, it's kind of half and half, right? And then in Chesterfield, it's pretty much more towards the VDOT side of things when it comes to doing a lot of things. But there's a lot of partnerships that have to be established at the local level. So we want to make sure that that's first and foremost. So then we go to the kind of the circle with the 3,186. And what I want to point out here are some interesting things that you don't hear a lot of in the media or the news. But it's most of these KA crashes, that's the total for the region, are related to people who are protected. So they're protected with their seatbelts and their airbags. And that's in the kind of the teal, what I call teal. And then the lighter green is seniors wearing seatbelts. So if you look at 2/3 of our severe crashes, it is speed alone that gets you, right? It is that crash energy of the speed that is the vector. There's exponential harm going on from speed alone. And then we get into the places where there is a lot more attention when we talk about pedestrians. And in the news over the past 3 or 4 years, it has been a pedestrian focus, as well it should be. These are our vulnerable users. But what I often say is all of these 3,186 people are vulnerable users, okay? Vulnerable to the crash energy. Just takes a lot less energy in a walking or biking or a motorcycle or unbelted crash for them to show up here. These are, of course, our built environment plays a huge role in our pedestrian walking, people who walk, people who bike. And then we have our non-unbelted. And the only thing I can say here is we really need to focus on passing the primary seatbelt law. We were almost there in the General Assembly this past go round, and there are huge changes coming through our laws, thankfully, that were adopted, and we're really excited about some of those. Stop for pedestrian goes into effect July 1. So that's anything under 35 miles an hour posted if you don't stop for a pedestrian. And then there's a vulnerable user criminal offense on top of that. So you get a misdemeanor if you do harm to a pedestrian or a person who walks or bike. So the law has really shifted there. There's going to be a handheld ban, which is getting into our distraction a little bit. It starts January 1st, statewide, and it starts in the city next Monday, I believe it is, or whenever, Tuesday, when June 9th is the date that was selected for that. Then I want to talk about the bottom real quick. Are there any questions so far? Am I boring you guys to death? Or, I mean, I get really passionate about this sometimes. You good?
Doing a great
Okay.
job.
Okay. So moving forward with speed on the bottom, I would argue that we calculate speeding the wrong way in this. 100% of these crashes, the 3,186 people, were speed related. There was enough crash energy for it to be speed related. So first of all, I would tell you to ignore what that says. It's actually 100%. Okay. Then we get to unrestrained, and I think that's important to focus on. That's the primary seatbelt law. Then we go to alcohol. There's a big movement right now of lowering the alcohol rate, and there's science behind it, from 0.08 to 0.05. So we'll see where that goes. There may be some legislation that comes up at the General Assembly at some point in the future. Distracted, again, that's underrepresented. I would say nearly 100%. We were not looking at the forward view, or something happened where we weren't really paying attention to lend to that. So it's closer to, again, this is self-reported stuff that we're given here. So I wouldn't pay much attention to that one. Age group is important to pay attention to, and user type is important to use. So my only thing here is, when you use those 4 tools, understand the data that you're looking at. Understand if you're looking at the TREDS report, hey, the last month or two is going to be underreported right now because they're still filling it in. Understand when you're looking at this chart here in Power BI that there are certain things. And if you have a question about any of these tools and, hey, can I make this statement or not? Feel free to give me a call or an email, and I'll try to respond as quickly as I can on that, because it's important to use the tools and know their limitations at the same time. And there's some great people at VDOT in the central office that really, and Brian is one of them on the phone, that really take this data very seriously and providing it. And this was a collaboration that we had, this Power BI tool, between the city and the VDOT central office to get it towards being a person-focused issue, not a transportation-focused issue. So we good there? That's probably the longest I'll talk on any one slide. Okay, if not, we can go to the next one. So I just wanted to put up here one of our vulnerable users, which is people who walk. And you can see, unfortunately, that Richmond is leading the pack when it comes to the injuries. And we are putting a huge focus on our pedestrian injuries and fatalities. So we hope to lower that number here. We did have a 2018 experience where we had 0 pedestrian deaths for the first time. So there are moments of brilliance, but what we were finding here with all of these things is there is an overlap with mental health. If you think about 3.7% of the population have co-occurring mental health disorders, that's 1 in 25 drivers. Okay, that's pretty scary stuff. So if you think that there's someone driving like a crazy person out there, it's because there actually is. And it's very difficult to unwrap our high risk impaired drivers with all the other things that we're trying to do. And so you can see this play out particularly with our pedestrians, where you have reoccurring things where it's impairment, it's homelessness, and it's mental health layered into these things of these types of crashes. So it's very, very much a challenge, and we're starting with a high risk impaired driver action plan. Hopefully that's an FY21 activity that we're going to try to do here in the city. Any questions on this slide? All right, we can move to the next one. I think we'll start to get into kind of our structure. There are a few things that I put up here. We can report to our TAC. We can have a bi-monthly meeting. I think, Chet, you were talking about consensus-based decision-making, and then our primary role in this is for us to serve as our point of contact for communication, coordination, collaboration. Those three things are very important when we talk about Vision Zero task force and trying to get the right people in the room and the right people talking to each other out of their silos. So if that sounds good, Chet, would you welcome the consensus of that's something to move forward, or is there any other comments here?
Mike, this is Diana. I'm looking. What do you see happening as a bi-monthly meeting?
Yeah, we can talk a little bit more about that, and as far as our duties go. But it's important to meet somewhat regularly. So either a quarterly meeting is kind of what our commission and our task force does in the city of Richmond. So a similar thing could happen. It could be, so I'd take bi-monthly as being once every 2 months. Am I reading that right?
That's right. And I was originally, I think we were thinking monthly, but I thought that might be a little aggressive. So I think it's up to whatever the group thinks would be reasonable. But obviously, I mean, staying in contact and continuing the discussion so things don't get stale is important.
Do we want to? Have we discussed? Chet, does it have it in the UWP, like the time frame? On how long we plan to, like the limits. That's the only reason I asked about the bi-monthly, in that, is this something that we think that we're gonna continue for 2 years, a year, or just how do we see this working?
That's a great question. I think for this work program, we just put it in as ongoing.
Okay.
I mean, I could see it as a standing committee that could be a resource for the board for a long time, but it may make sense to do this for a year and see what kind of what our successes and struggles are, and then make a decision for next work program.
Okay.
But I think it's got potential to be a really good resource for kind of thinking in a different way that the policy board doesn't consider all the time.
Awesome.
Just as technical advice, I would recommend at least 4 times a year. You could go up to 6, I guess, but at least 4 would be what I would recommend.
And maybe in the beginning too, I guess we can reevaluate. Our months will work, and then again after that, after a couple of meetings.
Yeah, bi-monthly sounds good to me.
Okay. Anybody else have issues with that? Okay.
You want to go to the next slide?
Yeah. And Mike, I think there's a couple comments in the chat. Stephen and Ryan had some points to make. How do you see the legalization of marijuana affecting pedestrian crashes?
Yeah, that's definitely going to be an issue with the co-occurring mental health issues. So yeah, it's definitely been a problem in Washington State and Colorado. They've seen a big uptick wherever it's been legalized. So I think they call it polysubstance use is really what is problematic. And if you think about marijuana use, there's really no field sobriety test that you can take to prove it. You have to have specialized drug recognition experts. There's a whole multi-level issue with polysubstance use. With alcohol, it's pretty straightforward. You take a blood test or a breathalyzer, and there it is, right? But it's not so with these other substances. Okay, do you want to move on to the proposed vision statements? Again, the fundamental principles are from Vision Zero. We acknowledge that these are preventable. It's human life is prioritized. We create our system, transportation system, for human error. And we begin at a system level and we follow it up with individual behaviors, and then we focus on speed. So then the vision statement is actually right below that, which talks about, and I'll just read it, the Richmond region is committed to a strong and effective Vision Zero action plan with political commitment, collaborating with multidisciplinary leadership, and using a system-based approach. Our plan is transparent, data-driven, engages our diverse communities in an equitable manner. I'll open up for comment.
And this is Sharon with Henrico. So, I mean, we don't have political buy-in on the official Vision Zero buy-in or program. We're just here to learn more. And we obviously pedestrian fatalities or any fatalities is one too many. And so I'm just here to learn more and see what we can do to improve.
Great, thanks, Sharon.
Any other comments?
So is this one that we take in and resolve a little bit later? Go from there. I think the statement is kind of our vision versus an adopted vision of the region, because what it's getting at is when you write a vision statement, it's like what should exist or what should be in place in order for things to move forward. And the reason the political commitment is there is it really takes political commitment to start to move down this path. And if you don't have it, if you're at the state level, it's the governor. If you are at the local level, and in the city, it's the mayor. If you don't have that voice, that makes it very difficult to get the resources needed to save lives and prevent these serious injuries.
I want to make sure that everybody is comfortable with this. So yeah, I agree. I think we should wait and come back to it. Chew on it a little bit and see what people think. I wonder if it makes any sense to kind of hold this as our work group's goal for the next year is to finish up this year with political commitment, if that's possible. To work towards that. I don't know if that's too aggressive or not. I mean, we are a diverse region, so I think everybody's coming at it from a different starting point. So I think it makes sense to kind of just let this marinate for a little bit.
Great. And just a point of reference, we formed our Richmond Highway Safety Commission, and we changed our name to the Safe and Healthy Streets Commission. But that was formed in 1966. And we didn't adopt the Vision Zero goal until 2018. When I showed up at the city in 2015, there wasn't the political fire yet to adopt Vision Zero with the political leadership, but by 2017 that had fully developed, and it takes marinating and cultivating and all of those good things in order to start going down the path. So it's very point well taken. So with that, you want to move to the next one, which is proposed mission statement. And I just wrote down what the city's mission statement is, and that's within this decade, we're going to get to zero. You can see there's 40 or so localities across the country, from counties to cities, large and small. They all have the same end result, and they have a different year. There's some at the national level that say by 2050. There are some that are 2024. So it just matters when they started. And, there was a big debate around the turn of the century at the state level when I was the state highway safety engineer. And the only thing that we could agree to with the partners was a 10% reduction, because someone would hold us accountable. Okay. Later, as Colonel Flaherty, and I'll name names, retired, he said the biggest mistake that I made was not making that goal zero. He was the one that was pushing for the 10% reduction. And so that gets back to kind of the whole thing about Vision Zero is, what's the acceptable number? And if you turn it around and you say, what's an acceptable number for our family? The obvious answer is zero. So isn't that a good goal for everybody? And that's kind of how that dynamic works. This is probably one that needs to marinate as well.
Anybody have any comments on this?
You want to move to the next slide? Okay, so some recommendations for implementation. What I noticed is when you have something like a Safe and Healthy Streets Commission, and ours comprised of citizens and professionals both, along with elected leaders, and multidisciplinary, from enforcement to education to emergency response to engineering to health professionals. When you get all of those people in a room and they meet quarterly, good things start to happen. And it's breaking down the silos. And so one of the first recommendations that I would have for each locality, and you probably have the makings or the start of this, where it may have everyone in the room or it may not have everyone in the room. And I'd be curious to hear each locality, if you have a moment, just to describe what level you're at, how often that you meet. Is there something that focuses on crashes on a regular basis? And the first thing is to kind of create the legislation where this body reports to your elected officials at the local level. And when that happens on all transportation safety matters, when that happens, that's where some good things start to happen as far as resources go in order to attack the problem. Because it's not just Mike in Public Works that's saying it, it's the Safe and Healthy Streets Commission that's saying it. And we found that has a lot of weight and very good action. So I'll stop there for a second.
So this is Sharon with Henrico. We have a quarterly meeting where traffic engineering, transportation, Henrico Police, and VDOT meet, and we talk about, crashes in the county, the different precincts, and overall why, and then the police give an update about the crash reports, or where's the top 10 per precinct, top 10 per county of the high crashes. And some police fills us in about what the crashes were, if they were very aware of, the pedestrian crashes, of course, or any fatalities, and trying to brainstorm together, what happened, was this preventable? I mean, well, there's a lot that could be preventable, but any steps that traffic engineering could take, or VDOT, that may have contributed, and just so people are aware and can try to make a difference. So that's one of the things we're doing currently.
That's awesome. Any others?
Yeah, this is Tom Coleman from Goochland County. I don't think we're quite as far along as some of our larger local neighbors are. We do report top 10 crash sites to our board quarterly, but I think really this is, we're really at ground level. It's really about understanding policies and tools that could be provided to them to improve the safety of our roads moving forward.
That's great. Thanks, Tom. Any others?
Hi, this is Nora from Ashland. Actually, it's just Mike from Public Works and Nora from Planning. And really Town Council as well. We don't have a committee, and our police department shares, I think annually, sometimes more often if we're seeing more crashes, crash data with the Town Council. So I'm excited to hear what you all already have going on and seeing how we could bring that forward.
Great.
As far as committees.
Awesome. Thanks, Nora. And just as a point, I included as the third bullet in the email this morning, the enabling legislation that was created way back in 1966 and modified here and there over time. But that's how our Safe and Healthy Streets Commission was codified. So that there's reporting duties, and they advise council on all transportation safety matters for the city. And so having something similar, you always want to make sure that when you throw the ball, there's a glove to receive the pitch, rather than throwing the ball out there and you don't know if it's going to be caught or not. So by formalizing the organization structure, and it could be to the board of supervisors, it could be to a planning commission, it could be to town council, it could be any number of those arrangements that fits your locality. But it's important to have it so that it's written down as part of the duties, responsibilities, that type of thing. Okay, great. And just bullet number 2 is, there's all kinds of funding opportunities out there, from engineering to enforcement, emergency response, et cetera. And that commission that we have helps us compete for those dollars. And so from a resource perspective, you really want to have the backing of your Safe and Healthy Streets Commission to be that added voice that says, hey, we're not just talking from a public works perspective or a planning perspective. We're speaking as these varied silos as one. And I think it's very powerful when it goes to that. Number 3 is we have a safety calendar. So each month we have a different topic, and we have leadership talking points that go out to all of the different departments. And so we've tried to mirror the national and state calendar. So like this past May was Bike Month. It's Bike Month in Virginia. It's Bike Month pretty much everywhere. But it's also our bike safety messaging for Vision Zero occurs in the month of May as well. This month we're doing distracted driving in the handheld band. Next month will be another topic. So it's important to have that sync up, and if we can have that sync up for the region, I think it becomes pretty powerful as well, because people pass between jurisdictions, right? Number 4 is, it speaks back to those resources. We have a lot of grants that we go after, and even I won't give away all my secrets, but even my smart scale applications will have a resolution from the Safe and Healthy Streets Commission. And I think that that's looked upon favorably. And then lastly, we just need to track these, right? We need to be able to report out at the local level and at the regional level what our death and serious injury trends are. And the last one also speaks to developing a regional Vision Zero plan. Now that might be something at a later date, I think it's very important to have the local commission set up first, and that should be a first-year goal, is what I would recommend. And then come up with, once those are established, have those groups get together to develop a regional Vision Zero plan. Again, it can be debated what the timeframes are and what the goals are and that kind of thing, the vision statement, mission statement. But I think it's important to eventually to have a regional plan. Any feedback?
Yeah, Mike, this is Chad. I mean, I think that for that last item, I think one of the opportunities that could be proposed this year is, I mean, we're headlong into developing our long-range plan. It won't even be completed this fiscal year. But one of the things we could do is not create the regional Vision Zero plan now, but we can certainly start introducing concepts. And I mean, one of the things we're required to do is talk about performance measures related to a much different metrics. But one of those is safety. So there's highway safety metrics, but there's also bicycle and pedestrian safety metrics, which we could start, introducing that language into the regional planning efforts.
Great. Any other comments? We can move on to the next slide. There is one. The evaluation, right? So anything that we do should be evaluated. And I think just high level metrics saying, does each locality have a safe and healthy street type of commission? It can be called something different. They routinely meet with local elected officials. It's multidisciplinary. It meets quarterly. If those things are kind of true, then I think that's something to track by jurisdiction. And then once that number gets sufficiently high, then we know that we're ready to go on to the next step of developing a regional plan. The other number 2 is, does each locality have an action plan? It could be called a Vision Zero action plan, or it could be called something different, but is it related to transportation safety? Do you have a defined high injury street network? We just updated ours, and get this, 7% of our roadways, 58 miles, comprise 62% of the death and injury. So once you have that kind of information, you start to attack it from all the different perspectives of enforcement, engineering, emergency response, et cetera. In that local plan, it would have your safety goals, your resources that you require, the priorities for that fiscal year based upon the resources that you have. The number 3 is just reporting on the deaths and serious injuries within the region to the TAC on a quarterly basis. And then 4 is always important. Let's celebrate our successes and then also report our barriers so that things can start to be addressed and continuously improve. So with that, any comments?
And then I guess quarterly, we'd have to figure out, of course, when TREDS is populated and time it appropriately.
And we always lag a quarter. So we would be reporting right now on January through March as that quarter. And when we have a quarterly meeting, we're always cognizant of what data is available. Any others? Was that my last slide?
Yes, sure was.
Okay. So that was the legwork I tried to do ahead of time. If there were any errors, it was done in about an hour, so forgive me.
Yeah, I think that was super helpful, at least for me. I think that personally I have a lot to learn, and I know everybody's coming at it from a different knowledge point. So Thanks for putting that together, Mike. Appreciate it.
Sure, glad to help out.
Thanks. And do you have a copy of that presentation, or was that you could share with us, or was that
It was put
attached?
on the, yeah, it's on the agenda or the calendar item.
Okay, thank you.
And we'll actually take the recording and post it on our YouTube site if you want to. That will be helpful too.
Yeah, I have a question to the group. This is Ryan with VDOT. Is any of the localities considering the reduction of speed limit as a countermeasure for reducing, I guess, pedestrian crashes, or no? I know we all use that chart that shows, the chances of you getting killed with what speed. But we have, I haven't seen any of the countermeasures for reducing speed limits. I've seen, pedestrian facilities only.
So in the city of Richmond, most of our streets are posted at 25. I think the highest speed limit we have on just a few streets is 45. But we still have the most injuries. So, when you talk about countermeasures, it needs to be focused on the higher volume, wider streets. Lighting is an issue as well, not necessarily in the city, but the visibility is extremely important.
Right.
As well. But to speak to it, the resource that I would point you to, if you're really, really, really interested in it, is the California report. It had like 4 or 5 different research papers in that, and it talked at great length about anything from the different modeling that they use to determine what speed a pedestrian could survive impact speeds. But again, until we get to the point where we know the impact speed of a vehicle at that time through kind of that black box that sits in every car, we're just shooting in the dark as far as what that goes. The best we have right now is the study that VDOT did with the Pedestrian Safety Action Plan.
Right. Because honestly, I'm seeing a lot of these projects being submitted through the smart scale. They're adding pedestrian sidewalks, crosswalks, everything. Basically, they would be expected to see more pedestrians, but no plans on reducing the speed limit from current, which is like 40s and so. But the 25, you can't reduce it beyond that. I totally understand that part. Which, I'm thinking maybe it would be really nice when we want to make it pedestrian friendly to consider maybe reducing the higher speed limits into something maybe less than that.
It's definitely context focused, right? So as you enter into those high pedestrian areas where people are walking and using all different kinds of modes, you want to use your traffic calming toolbox to apply that to even the arterial. And I've seen something recently that VDOT's been really good at with at least whatever the posted speed limit is, they've timed their traffic signals and progression now to be the speed limit. So I watch people speed ahead of me, and then I catch up to them at the light when I'm going the speed limit, and it happens over and over again. So and we've done that as well. So if you go faster than 25 on a posted 25, you're going to be stopping at the next red light. We'll see you there.
Nice. Thank you very much.
Okay, so what's the committee's pleasure? Should we set a next meeting date? Do we have homework?
Yeah, we should set a next meeting date. Would that be August, or every 2 months, or September?
I think if we're doing 2 months, we'd look at August.
Okay.
What do we think about the week of, try and keep it like this, either the week of the 6th or the 13th?
13th.
Oh, 13th works well.
13th works for me, Sharon.
Hey, this is Tom. 13th work.
This
Okay,
is Nora.
anybody?
Right now that can work. And I have to hop off. So I will see you all in August.
Thanks,
Bye,
Nora.
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 It's
So what did
Diana.
you say?
That works for me.
Okay, we'll say 3 o'clock again on the 13th.
Sounds good.
Yes, sir.
Great. Okay. Mike, Sharon, do you have any thoughts on anything that people should focus on between now and then?
I would just maybe focus on figuring out who's in your committee or your commission and who you have in the room and who you need to get into the room, and reaching out to them to say, hey, we're thinking about starting something. And it can be informal at first, but you need to have that regular rhythm to establish legislation if you need it, so that it's all tied in, so you have the glove ready. That's what I would focus in on. I'd also look at your data using some of the tools, and if you need any help with that, just let me know. And if you have the moment to figure out what your high injury network is, that would also be good, because then you start to really hone in on where the problem is.
Great, and I'd encourage everybody to take a look back at those 4 links that were in the presentation. Noodle around, see what's there if you're not familiar with it, and lots of great data. Okay, well, thank you all very much. We're 1 minute short, and take advantage of that and let everybody go. So thanks for your time. Looking forward to working with everybody.
Thank you, Chet. Thank you, Mike and Diana.
Thank
Take
you.
care, everyone.
Thank you very much. Bye-bye.
Bye.